We hear a lot about the mommy makeover, but what about the Grammys out there? Women beyond the mommy years want to look and feel their best too. So Dr. David Whiteman of Southern Plastic Surgery is here to tell us about his revolutionary Grammy makeover. Welcome, doctor. Welcome back.
Thank you. Thank you.
When I first heard Grammy, I was like, oh, are they going to look like Grammy winners or singers? And I thought, no, Grammy is in our grandmothers.
Exactly.
You know, just because people are getting older and they're not mommies anymore doesn't mean that they want to, stop looking and feeling their best. And is that why you decided to come up with this?
Exactly. Really, people exercise, they eat well, and they feel well, and they kind of want to look as good as they feel.
Absolutely. So talk to me about, we're going to look at a patient before, and let's look at some of the areas that you said, or she said, this is really what I want to work on, okay?
Sure.
All right.
So the areas that we kind of focus on are eyes, neck, and other things that kind of tend to sag, breasts and belly.
Yes, of course. Okay, so take us through our first picture. These are eyes. Obviously, huge difference in terms of the bags, just how tired she looks.
Sure.
So talk to me about what she did there.
Fairly simple procedure. Recovery is really about 5 days with no pain. One of the biggest giveaways to aging is eyes and neck, followed by hands, which I think we're going to talk about later.
Okay.
This is a relatively simple procedure. It takes about an hour. And what we've done is we've removed the fat and tightened up the skin.
Incredible. Now, did you do it on the top as well? Because I feel like she got a lift up in the brows.
She had her upper and lower lids done.
Incredible. It looks so much younger, just that alone. But of course, you did a couple of different procedures, right?
On this lady, just one procedure.
Oh, just one on this one. Okay,
Yes.
Next one is the hand. Show me this.
So this is a kind of a new procedure and a great one. This takes about 5 minutes in the office. It involves a placement of a filler underneath the skin of your hands. It plumps out the hands.
Wow.
The hands are a very significant giveaway to age, both with dark spots and volume deficiency.
Right.
It will last about a year. It's great.
Yeah, it looks so amazing. And one of the things that's true, I'm 46, and I can already see those big veins, and my hands really are starting to look old. So the filler is sort of revolutionary in the fact that it's being used here now and not just in our face, right?
Right, and this filler was originally used on the face, but now it's actually FDA approved for the hands.
Got it. Okay, just beautiful. So now, before we bring out the patient that you worked on that's here, the Grammy, let's look at the before, and you can kind of walk us through.
So this is Deborah, and Deborah kind of came to our office, said, I'm looking tired. And Deborah is a kind of person full of vitality.
Yeah.
She does home construction, she's an artist.
Wow.
And she has, I believe, 5 grandchildren, but she doesn't want to feel like the kind of Grammy, or Mimi, as they call her.
Of course. Well, and she's beautiful, but like you said, it's about feeling. If you look and feel young and vibrant, and you're just looking in the mirror and not seeing that reflected back, you just want to do something about it. So what did you do?
So Deborah actually had her eyes done, and she had, I believe, upper and lower lids, as well as a lower facelift or mini facelift, or I call it like a rapid recovery lift.
Right, for the neck and kind of the jowl area.
Exactly.
And without further ado, Deborah, take a look into that camera, camera 6. You look amazing. There it is. And talk to me about the whole process. What was it like, and why did you choose the doctor?
I chose him from a recommendation from a friend.
Yeah.
Who said he was the best, and I think he is.
Yes.
I wanted to look like I felt.
Right.
I feel great. I do a lot of different things. I do habitat bills. I do adventurous things and whatnot. So I just wanted to be me again.
Yeah, absolutely. You look wonderful. Like I said, you had a beautiful palette he had to start with, but just the difference in the eyes and the neck. I mean, I can see it right there underneath the chin. So phenomenal.
Sure. What I'd like to point out also is that many people think that with plastic surgery, they're going to look fake and artificial. Our goal in a Grammy makeover, as well as other procedures, is not to make you look younger than you should be, but to make you the best version of yourself.
Absolutely. We've got some quick questions. I know we want to get to these. Okay, first up, this is for Deborah. How long did all the procedures take?
A few hours for him to do my face.
Right.
What about recovery?
Recovery was really quick. As you know, I took one pain pill. Just a
Come on.
One.
You're tough. But you didn't, but then that was
it the night of the surgery when I got home, and I thought, well, in case I have pain, I'm taking it. And I woke up the next day and
That's
it's
actually
fine.
pretty normal.
Pretty normal?
Yeah.
That's incredible.
Yes.
A big change from the way it used to be, right?
Yes.
In terms of the downside, the downtime and the pain. So that's wonderful. And I know we have a second question. Did anyone notice the difference in terms of how people reacted to you? You know, were people like, oh, you look great, or what are you doing?
Yeah, exactly. I got that a lot.
Right.
And they'd say, you're just getting better with age.
Yeah, and you said, that's right, call me Benjamin Button. I'm aging backwards. Okay, how about how the makeover has made you feel on the inside? It sounds like like he was saying, and you're saying you're very active, you're very adventurous. Now you feel like the outside reflects that.
I'm me again.
Yeah.
I'm me. I have a lot of energy. I go.
Yeah.
And I'm not stopping.
Yeah.
And I'm not gonna look like I'm tired all the time when I'm not.
When you're not, exactly. Okay, Doc, a couple of ones for you. Where's the first one? Finance options available. A lot of people want to make sure that, you know, they really
Sure.
want to do this, but it's got to fit within a budget.
Sure. Well, number one, I think the biggest thing about plastic surgery is it's actually not nearly as expensive as most people think it is.
Oh.
Secondly, we have at least 3 financing options available through our office that allows you, if necessary, to pay this out over time.
Okay, terrific. So you do have some options. When in doubt, just call and schedule an appointment.
Right.
Another question is for the hand. The hand makeover, let's talk about that one and how long will it last?
This should last at least a year. Actually, this is an injection that has the potential to last, I would say on average, anywhere between 10 months and kind of 16 months. And no, you don't have to go back and have it checked every 6 weeks or so.
Yeah, good.
No, not at all.
That's terrific. Again, just like the filler in the face, it's meant to last more than just like a quick fix or like Botox, which is just a few months.
Sure, Botox is maximum kind of 4 months. The
Yeah.
fillers, if that's 4 months, you really need to be having it evaluated.
Exactly. You
Okay.
need to go to a new doctor.
Yeah,
You need
okay,
to
you
see you,
said that.
Dr. Whiteman. And I know you have a great offer for Atlanta and Company viewers, so tell us about
So
that.
we do, and actually this is an offer that we're offering to your viewers. It is, if you have a filler treatment, or you complete the filler treatment on your hands, then you will have a free Botox treatment complimentary.
Fantastic, wonderful. Thank you so much. You look amazing. And thanks for your time. It's wonderful to see you again.
Sure.
All
Very
right.
well.
If you would like to contact Southern Plastic Surgery, please give them a call today, 770-622-9100, or log on to southernplasticsurgery.com.